risings, everyone. Welcome, welcome. If you don't know who I am, my name is Miss Grace, and you're here with me 3 days a week in the morning in my kitchen, where we be talking about political, social, economic issues. I'm expanding the topic. Yes, I'm here for it. Today, we're going to be talking about the changes that this administration, Trump administration, and Robert Kennedy Jr. is making in our healthcare sector. This is something that we need to pay attention to. Trump has announced the great healthcare bill. And as as sensible people like we are here, we use our critical thinking skills. Just because it has great in the title doesn't mean it's great. So we're going to take a look at what's out there in the news. We're going to look at the White House press release about the great healthcare plan. And you know what we do here. We look at the topic from an unbiased perspective. If you don't know and it's your first time here, my name is Miss Grace. And we look at issues from a non-biased perspective, highlighting that I'm not a Democrat or a Republican. Let's get to it. All right, let's play this clip real quick, and then we're going to listen to the full speech from Trump. Okay, hit the like button. Thank you for being here. Hopefully, we'll get the sound on for you guys as soon as possible. Let's see what we got going on here. All right, let's play this video. Thank you for being
Really
here.
make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan. Instead of putting the needs of big corporations and special interests first, our plan finally puts you first and puts more money in your pocket. The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is. The big insurance companies lose, and the people of our country win. This proposal locks in the massive discounts on prescription drugs that my administration is achieving through our most favored nation drug pricing agreement. Now, when you hear about that, for 40 years they've been trying to do it, but they never were able to do it. No other president was able to do it. I got every other country to approve it by the use of tariffs and other things. They all approved it. Nobody else got it. No other president got it. And for the most part, they didn't even try because they felt it was impossible. It'll bring down drug prices 80, 90%, in some cases, just numbers that nobody's ever heard of before. Your prescription drugs will come way, way down. And under this policy, the prices of many drugs will be slashed by 300, 400, and even 500% starting this month at the TrumpRx.gov. So instead of Americans paying the highest drug prices in the world, which we have for decades, we will now be paying the lowest cost paid by any other nation. So
give me a second, y'all. I know some of this is making y'all teeth grit this morning, okay? But let's just listen because I'm here taking some notes. And it sounds like the rig and the 52 fake out for me. We're going to talk about it, okay? I pray that he can lower the drug prices, but we're going to talk about why our pharmaceutical prices are so high in America versus other countries. Also, I have to do it. You know what we're going to do. We're going to compare how much ICE budget is compared to the healthcare spending. I'm going to do it. I'm not about to play because that's our tax money. So, okay, this is some of the stuff. Do you guys want to hear the full 5 minutes? I want to give Trump the chance, but I think we could do our research on our own because he puts a lot of rhetoric into side stuff and it really just, oh. But anyway, now, let's just listen to someone weigh in on, some of the things they're going to be addressing as far as what's in the great healthcare plan. Now, we're listening. I didn't break anything down to you. We do have the presidential White House page up, and we're going to read it. Okay? We're going to read it. We got it right here, January 15th. But we want to hear what everybody else has to say as well. You know what we do here. We kind of compare and contrast and, put make the truth our truth, not their truth. Please hit the like button. Thank you for being here this morning. Especially as we are addressing, hold on 1 second, a variety of topics here. I hope you guys like it. I love these topics. I am so grateful to be here. We're able to just talk about this. Let's go. And as you guys know, I am a registered nurse. Okay, so That's not some of the things I'm going to talk about here, but that's where some of my mindset come from when we talk about this issue. Let's go.
At a much lower price, which is the two
And
things we
blessings
want:
and good
great health
morning
care.
to everybody because I came in just running my mouth. Blessings. Thank you for being here. Highly favored. Everybody else get an audience. Tell me how you feel because a lot of people are affected by this. Even if you don't know it, at some point you're going to have to go into a hospital possibly or get some type of health care. So let's see what's going on. How him and Robert Kennedy Jr. is reshaping America's health care.
And we want low price. You can have great health care at low price. Now you
Great.
have terrible health care at a high price.
Brother, everybody knows what's wrong. The question is who's going to put it right. And, you know, the president can say, well, my health care plan is great. I mean, that's why it's called the Great Health Care Plan. Yeah, okay. That's not what makes something great. Now, again, I know there are a lot of people out there who never want to hear a good thing about this president, deservedly or undeservedly so. I get it.
Let's fast forward. I want to listen to the lady, not you. I like you, sir.
Now,
you're good, but I want to listen to her. I want to listen to her.
Let's talk about what he says is his plan. How do you see it?
First of all, I agree with you completely. I love that we're talking about this and having the conversation. And it seems like this president is wanting to pick a fight. Boy, do we have a fight for him. I mean, we are talking about going up against the biggest and the baddest in the economy. 1/5 of the U.S. economy is healthcare, over $5.5 trillion. If you want to pick a fight, let's stop what's going on in Minnesota. Let's really get into how strong we are.
Thank you. Let's go. Let's hit these issues. I'm with you, ma'am.
Okay, so we want to go against healthcare? Let's do it. When I look at this plan, I see, the preamble, and I want to dive in. I want to see the details. So, I'm going to reserve a little judgment and say, I want to see the details when they come out. But first of all, when you talk about company or country, as you did,
company or country, I thought I was the only one that interchanged those concepts. Is this a company or a country?
Talk about lowering insurance premiums in this great healthcare plan. They say we're going to stop sending subsidies to insurance companies, and instead we're going to send money right into Americans' pockets so that they can spend money on the insurance and the healthcare that they choose.
We got to stop. We got to stop right there. Houston, we have a problem. Okay, we have a problem. Let's just break this down right now. This is just a few things that they're talking about addressing. The government wants to send us money in replacement for the subsidies that they give the pharmaceutical companies, the insurance companies, things like that. Now, you know what that means because those big pharma companies and insurance companies don't want to lose money. So what's going to happen when they lose those subsidies from the government? How is the prices going to go up? I mean, go down when they're going to want to make the same profit margin or close. So you're telling me now they're not going to receive a subsidy and you're trying to lock them into a particular rate in contrast to all these years that they never been controlled. Now, let's just keep it real. This is one thing. That's why I said this got to be the 52 fake out because we're going to get to this. In 2026, the U.S. health core sector faces critical challenge. It says driven by unsustainable cost increase and medical prices. And we have terrible healthcare practices. I'm just going to be honest. Okay, and it says 3/4 and new drugs prices exceed $375,000 annual. Okay, so what are the key issues that's driving our prices up and other countries down? One, rising costs and financial pressure. Inflation and high labor costs are creating immense financial stress for providers, allegedly. Okay. Roughly around 41% for adults reporting medical and dental debt. That's me and you. With 62% worried about affordable care. There are people that are so afraid to get a medical bill that they don't go to the hospital. I had to convince people by me telling them this. A medical bill will not go on your credit report. Take yourself to the hospital. They will sustain you. They have to, and you get up out of it. That's how serious it is when someone feel like they're on their last leg and they will not go to the hospital. That's why we're talking about this. The next issue that we're facing here is the work shortage. Again, because they're not pushing these type of educational programs here. Again, some of the things that Trump defunded. Okay, federal subsidies that's going to help our educational program push certain incentives for certain, how can I say, technical or professional skills. Again, being a nurse is not a professional skill. It's okay, but I still had to renew my license and do 30 hours more of continued education and, and do a whole lot of clinicals, but I'm going to keep it moving. With that goes to say, the workforce shortage, I think that's going to continue because they're very disrespectful to us as nurses and healthcare providers. Okay. We're going to get to that today. I'm not going to start complaining about that. Administrative burden and it says payers denial have increased. So you remember what happened. What is that guy named? Luigi? Okay, and they're kind of trying to keep it quiet because Luigi looked like some of his charges is being changed and things like that. I think we should go into that one late night. What's going on with Luigi case on the low? Okay, it looks like he may get a lighter sentence or something. We'll talk about that later on. But what pushed him to that particular situation allegedly was denial of care. Seeing these big pharmaceutical execs over there living their best life while someone is just trying to get some back medication, pain medication, support equipment that they need. I see this all the time because the sector that I'm working in, a lot of equipment is delivered to my patients, and it's a fight. It's a fight even to this day. Now, so this is the issue. They're saying that it's 11% increase in denial rates and claims since 2022. So this has been an issue as well. Now, I'm saying these things because this is counteracting kind of what Trump is saying was going to help our system, because we got to gut it from the inside. We can't just go in there and just negotiate a deal with Big Pharma for 2 to 3 years while Trump is in presidency. Whatever. Hopefully not long. Shut up. While Trump is in presidency, to kind of put a corkscrew in it so he can look like a superhero. And at the end of the day, they probably have some backdoor plan or something else rigged in that agreement that they'll be able to make some money back. Usually that's how it goes. So I'm kind of looking at it like a system approach. That's why we're talking about this. So I'm kind of saying what makes it different from here, from other countries. And this is why other countries are not having this issue. Okay, so drug prices access again. The drug prices have more than doubled since 2021. Why? What happened in 2019 into 2020? Everybody, let's go. Come on. It's big business now. And I'm going to be honest, as a nurse, when I was starting to invest and I learned about investing, I was like, yo, I should invest in gloves. You know how many gloves we use, things like that. And I started investing in medical equipment. If you look at the stocks of medical equipment, especially related to radiology, um, heart diagnostic, laboratory testing type of equipment, the stocks are going up. It's big business because something happened. Something happened since 2019, and I'm not making light of it. I just have to make light of it for the algorithm. And it made a lot of people sick. Okay, you heard Robert Kennedy go up there and testify about the numbers. At least he was being honest about it. Because I'm going to tell you, I was one of those nurses. I even made it to the Atlanta Journal, y'all. I'm gonna put that article at the bottom. Okay? I made it to the Atlanta Journal as a nurse. I was one of the few nurses who wouldn't take it, and they asked me why. We did a 30-minute interview, and they took 5 lines from me, but they were good lines. Basically, that I wouldn't take it. The reason why is because I was practicing my nursing due diligence like they taught us, and that's to make sure that it was evidence-based behind the treatment. And at this point, I said they were in the beginning phase of experimental. They skipped it. That's what I told him, but they ain't put that in there. But okay, let's move on. All right. Healthcare. I'm not gonna go too deep. This is why they try to shut me up. Let's go. So a lot of people got sick around that time, and what happened? The drug prices went up. Who was negotiating these type of things? So let's move forward. Now let's get into the President Trump unveiled the great healthcare plan. I'm kind of gonna skim through this, guys. Where all the dells, you guys can go through this yourself. It says President Donald Trump. President Donald J. Trump. Okay, I'm not gonna play. President Donald J. Trump, great healthcare plan is a broad healthcare incentive that will slash prescription drug prices, reduce insurance premium, hold big insurance companies accountable, and maximize price transparency in America. And that's one of the issues here too as well. Like they don't put the prices up there and they actually charge you based on your insurance company or your insurance status. Okay, if you don't have insurance, they'll cut your bill in half and try to work out a payment plan with you. Yeah. So the plan was the plan will deliver money directly to American people, highlighting if somebody get that money, they may not spend it on health care. But again, we're all adults. It says not insurance company, big farmers, and special interest groups, putting patients over industries, leaders profits, just as he promised. The great healthcare plan also builds on success of his first term, promoting competence, eliminating wasteful spending. In his first term, he was the one that did warp speed. Okay? He did warp speed. Let me not get distracted because warp speed was not the best thing. As I just told you, the reason why I told that newspaper why I didn't do you done skipped the whole clinical trial on human. You were supposed to ease this down the road in little groups. You literally amassed it to the whole world and said it was safe. Warp speed. And now he gets some of the blame on top of, Biden coming right in behind and following status quo. That should have been an eye opener for you guys because it was the same damn thing going on. This is what we're reading right now, guys. So you guys can go read it yourself. This is on the White House website. We kind of like summarizing it just to see can we get the key points of what he said he's going to do and send us a little bit of change, probably a lie. He's going to base it on our income. How many people in our household? It's not going to be the same, most likely. It's going to be something. And like I said, the insurance companies are going to try to get their money back. They're not going to lose two ways. They're not, because they know it's going to be a high rate of people not paying their insurance bill. I mean, their medical bills, excuse me. So they're going to increase their risk of people just not paying their bill. Then you're going to see a law that they got in the works allegedly that's going to try to put healthcare expenditures on your credit report. Okay, let's talk about it. This is what you need to be talking to these people about. That's why the lady said, y'all want to argue, y'all want to fight, y'all want to pick it. So let's talk about this. Oh, let's get it. Because this is what we really need to fix. Okay, we are the sickest country in the world, but we the best. So this is what he's saying. I'm thrilled to announce the plan of lower healthcare prices for all Americans through healthcare affordability. Again, we will be doing that that nobody ever seen, ever done in their life. The great healthcare plan. I'm reading it. I swear, I promise you, guys. I used to improv a little bit. Instead of putting the needs of the big pharmaceutical company, they're kind of paraphrasing what we just read. This is the bullet point. So I guess this is the summary of what I just read to you. So it's in bullet points. Okay. So they're talking about the downtrout of how much prescriptions are going to go down. But you can't promise that these pharmaceutical companies are going to do this particularly, especially for medicines that are becoming a trend, i.e. diabetic medications that they have now sub-use for weight loss. You think they're going to lower the prices? Because the demand is up. Does that make sense? All right. It's a little bit crazy. All right. So I want to see how he's going to get this price agreement with Big Pharma and keep them at bay, highlighting that they had no oversight all this time and they did predatory contracts with us. I'm not going to say the names of the company, but I was one of those deep diving nurse people during there. I have a whole page. Look at the bottom of this description. You could go to my Instagram. It's not active right now, but you'll see all the video and all the proof of everything that I was trying to explain to people during the COVID, and a lot of it came true. And I do empathize with a lot of those people, but kind of let's move on before I get in there. So let's see how he deals with the pharmaceutical companies, highlighting that those predatory agreements that they did during those times, allegedly, because I haven't seen the contract, but they allegedly use some of our government property as collateral for promise of payment. So we bought a big boat of all this Pfizer and all of this stuff. That's why people, when they were getting it, they was actually getting placebos, expired ones, things that wasn't handled properly. Them shits was sitting inside a storage house because they ordered a lot of them. And why I have proof of that? Because when they actually passed the bill, like the real, allegedly, the real COVID vaccine, because there's another one called law. Oh, I remember this off the top of my head, baby. This was the transition of my damn life when I walked away. Like, look at this. Law was passed, okay, as the actual vaccine that was proven. There is a young boy, I think his name is Watt. I can put his case at the bottom because I did a video on it too, as well. I was tracking his case. They had a lawsuit against him. He had a lawsuit, his estate, 19-year-old boy who died from the other ones that was released from us after the approved one was already supposed to be in circulation. What they came to find out, and I'm telling you this because this is our healthcare system, and I'm kind of telling you this from the inside. I did a deep dive on this. Come to find out that basically because the stockpile was so big, they had to get rid of it. So this, and guess who was in charge of it? Not our doctors, not our pharmaceutical. He's suing the DOD. Who is the DOD? The Department of Defense. And I will end off because I blame Trump for this too. Because he made this statement, if they don't want to take it, we have soldiers, we have people, who could just, and they started letting anybody give it. But this is why we're here. So let's just move forward. I know I gave y'all a mouthful, but this is what we do. Okay. And now, after he has released this plan, y'all guys can go look at it. Looking at the skyrocketing healthcare insurance rate in U.S. So we're going to just look at this little short video. I'm not going to look at the whole thing, but we're going to talk about it a little bit. This is 13 News because we're going to rate it from now until, let's say, 6 months from now. We don't even need a year because once he implements this, and if he can't get a deal with the big pharma and put them to heal, bye. That check gonna be gone. Y'all gonna be spending that on some dinner. We still didn't get our $2,000. Hit the like button, please. Thank you. Y'all can hear it. Sorry, it's low.
We have parents, seniors, families, small businesses. A lot of people have been struggling to keep up with those health insurance costs. Even as the monthly premiums have gone up, people are still facing high co-pays, surprise bills, denied claims. And so there's a lot of conversation right now for people on how they can afford these costs. And with more on this and why these healthcare costs are so high, we welcome former health insurance executive and president of the Center for Health and Democracy, Mr. Wendell Potter, who joins us right now. Wendell, can you hear me?
Let me see, can I speed it up for us a little bit?
I can hear you, and thank you for coming on to the show. We certainly appreciate it.
Thank you.
A very important topic here.
For being here. Please hit the like button.
Okay, I got to ask you this first question first, right? Why are families paying more each year when we're talking about premiums and deductibles and co-pays for health insurance in general? What has driven the high cost for the average day American when it comes to their health care?
Two words, corporate greed. And
because of what are these two words? Two words, corporate greed. Simple. What we just explained. Let me see how you're gonna put big pharmaceutical under your belt, Trump. What you about to do? Kidnap Pfizer president too? Shit.
Have changed over the years.
I'm gonna lock him up.
I was an executive of Humana and Cigna for 20 years. The companies have become massive corporations, and most of them are traded on the New York Stock Exchange. First and foremost, they have to satisfy profit expectations of those shareholders and a handful of Wall Street financial analysts. And to do that, they have to deny more claims. They have to make us pay more money out of our own pockets for care, even as the cost of the health insurance policy gets more and more and more expensive, and restrict their access to doctors and hospitals. These are barriers they set up just so they can enrich their shareholders. And all of us are paying dearly for this.
Let me stop right here because I just want to add something since they kind of like taking the burden off the hospitals as well. Now you have to understand too, sometimes these hospitals be doing, how can I say, examinations that don't need to be done. Like you'll come there and say your arm hurt. So instead of them give you a muscle test that's cheaper. They'll give you a whole x-ray and an MRI. I'm just kind of throwing something out there, hypothetical. So when it gets to the insurance company, they're like, yo, you didn't need to do that. Denied. So again, services provided and time provided is cash to the hospital. So they lost money again when they go to bill. But that goes to say some of the practices of the hospital again. Oh my God, I just had a flashback when they kept saying that they was intubating people and they didn't need to. People did need to get intubated, but I think they allowed them to get to that point at the end of the day, and some people was excessively intubated. Again, that was a particular service that may not needed to be done with many of the older patients if we would have just treated them early. Okay, let me just move on. Okay. All right, I'm gonna try to get through this without flashback, but I'm making it funny, y'all, because I haven't talked about healthcare. I talked about this in a while, but let's just get it because we gotta talk about this. I'm dead up. I'm dead serious.
Their own pockets. The family policy these days costs about $27,000 on average.
Jesus.
That's the price of a car. And even with that, the value of our insurance policies goes down every single year. So it's high time that Congress does something about this. This is a historic week because members of Congress are hauling in the CEOs of 5 big insurance companies for congressional hearings, and it's they're going to be in the hot seat.
Whatever. You see what I'm saying? I think like that's right there. It's all theater. And thank you to Wendell Potter for his information. We're going to put that video at the bottom so y'all guys can finish. That to me is theater and telenovela. Why? Because what you're going to sit there and get on these big pharmaceutical companies. Oh, your price is this, that, and the third. Why did you do that? And you know this is that. And you know you sell it here for this. You're blind bitch. This is America. We ain't got no regulation here. You ain't say that we couldn't sell it for this particular price. It has been on this and what are you trying to say? It goes back to regulations. It goes back to one of the things that I had up. I can't find it, but I did remember one of the issues is that it's called market dominance. So they'll have 3 like sub companies, shell companies that makes kind of the same medicine, but a little bit different, a little generic, and had the patent for each one of those in the original one, which closed off other people from kind of having generic patents of that, because they kind of just dominate the market because they have 3 or 4 different types of the same thing. Do you get me? Do you get me? Okay. Yeah, this is what they do. So at that point, they got the market because they are the main providers, no matter what you look at it. Okay, Johnson Johnson, which one you want? When I knew that they were subsidiary, I'm saying that word wrong because my tongue is heavy, but they were sub companies to each other, Johnson Johnson and Johnson, same one. And I'm like, you just changed it because Johnson Johnson got sued for this, that, and the third. I'll move on. Let's get into RFK, okay? As you said, guys, I try not to be biased or anything. I actually have mixed feelings about RFK because I liked his approach during the OVID. It was only a few that was out there. I think they called themselves the Fantastic 10 or whatever. They was out there doing their damn thing, and I really loved it. I attended somebody, Peter McCall, one of his seminars out here. I was the only Black person. I gotta tell y'all story. Just short. I was the only Black person. Yes, but they didn't treat me weird. But what ended up happening is they asked, this is how God works, and we gonna watch this. They was like, how many people have gotten the COVID? Da, 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 put your hands up, da, da, and they're talking about the approaches and what they got, how they were treated or whatever by doctors and disregarded. They was like, so how many people did not? Let's make this more easier. Yo, I was the only one in that. Ooh, I didn't get it. I still didn't get over it. And I got antibodies. Gotta be the glory. Ching, ching, ching. It's the hat. It's the Hebrew hat. Okay. So that was my experience. So I do got love, respect for what he has stand for. History is a little bit shady. You know what I'm saying? Messing with that cocoa. But, I'm from the hood, that wood. So I'm holy and hood. I try to have understanding for it. But he better do things right because he has an idea to reshape the system, and we're going to talk about that. Let's watch this clip. Thank you for being here with Miss Grace. Okay, I love talking about this. I'm such a geek. I love this. Hit the like button. Let's pray for Minneapolis and wherever else Trump sent his goons to, but let's try to take the focus and the energy off of that so we can focus on what the hell he up here doing. Oh, he hooking up our system. Let's see what they doing. It's already messed up, but let's see.
Holiday season for empowering us at HHS, me, Dr. McCary, Jay Bonachara, and Dr. Oz, to change the trajectory of this agency towards public health in a way. The tradition of serving the mercantile interests in the medical industrial complex and the big pharmaceutical companies. 2 weeks ago, we ended, under your leadership, a 20-year war on women by removing the black box warnings on hormone replacement therapy. The medical cartel was telling women that hormone replacement therapy during menopause was dangerous for them. In fact, here's what the science said. It diminishes the risk of fatal heart attacks by 25%.
He's talking about the hormone therapy.
Alzheimer's by 35%. Bone fractures by 50 to 60%. It improves appetite, it improves sleep, it improves energy, it improves happiness.
All right, get to it, baby. We're not about to do that. I love you, RFK, but we got the wrong clip. You doing too much. Now, this is his policies. I like them. You know, we just be hard to listen to, but I'll be trying. All right, so as of January 2016, HHS, and that means I need to slow down. Secretary Robert F. Kennedy Jr. is aggressively restructuring federal healthcare agencies under President Trump. So these are the latest updates. Again, I'm saying again, but we didn't mention this. Vaccine policies. So as you see, how I feel, I don't think it should be forced on us. I do agree that it should be looked at on a case-by-case basis. Parents should have the right to say no, and they should be fully informed of the full side effects and what could happen. Because I'm just going to keep it real. I don't care what they say because I ain't at the bedside no more. I ain't never give a vaccine but once. And that time I gave that one, it was a bad reaction. I said, never again. And it was just a regular vaccine. But I knew I didn't want to give it to this lady. And they kept bothering her. And because allegedly, that's why I'm against some of the things they say. Because what I see, that's why it should be a case-by-case basis. She was a cancer patient and she had a bad reaction. I mean, fever, everything. I said, never again. So me, myself, I never push for it in the hospital. Once you say no, I ain't coming back. I take it off tomorrow because what they have done, as soon as you come in and you say you don't take a vaccine, they put it right on your mark. They didn't ask you, and then we get the consent. When we like, we got your vaccine for you, and they're like, what? I didn't have no vaccine. I was like, yeah, it's on your mark. The doctor ordered it for you. Would you like me to give it to you? So we supposed to give full disclosure. Many nurses don't. I do. Once I'm done, they're like, well, I'm going to wait till I go to my doctor. I said, cool, go to your doctor. Thank you. So I like the fact that he's allowing parents to make the decision, especially children. I mean, when it comes to children and baby, because they forced it on us. They forced it on pregnant women. You know what I'm talking about. And babies. And today years old, we got strained relationships, sick people, and nobody taking this 8 times back to back. Like I said. So his next change is agency overhaul. Kennedy has replaced key leaders at the CDC and FDA with his own head selected team. That's probably some of those 10 doctors and stuff that was up there. They were like the Fantastic 10. I need to check that out. That focus on MAHA priorities. So I'll look this up to see what their priorities are on later broadcasts. As a couple of weeks from now, we'll follow up. And Trump support, it's a congressional tension. Despite some Republicans' concern over the rapid pace of changing and staff loss, Kennedy moves ahead and centralize and reduce the size of HHS. You're reducing the size of a body that is supposed to be there for research, guidance, funding. That's what they're supposed to be there for. They're supposed to be a part of disseminating information to the clinical floor that we're on. So you're just knowing that these people out here be cheating to become doctors, nurses. I'm just keep it real. Which Ooh, let me move forward. You already saw it was a whole bunch of, where were they from? They was from Nigeria. Sorry, Nigeria. I think nurses who got caught in Florida a couple years, 2 years ago. Okay, moving forward. So the next issue is the resignation calls. It was a issue as well. Policy changes. Some family members and medical organizations had called for his removal, citing threats to the public health. So they basically want to remove our Kennedy because they're so used to the status norm of what healthcare system has put down everybody's throat. And I'm saying this as a nurse, and I'm not talking against healthcare because me working in all sectors from starting in psych, health, home care. I went into long-term care. I did med-surg, tele, PCU. I just finished off in ICU as a pediatric nurse. That's what I'm dealing with now. So honestly, I've been having ADHD in nursing. I've learned a lot. But what that goes to say, I have seen growth. I have seen people actually come back to life. The practices do work, but the system that's fueling it is all about money. And when that's fueling it, that's where we have a damn problem right there. Because now they're cutting back on staff continuously because they want to make that profit margin. They think AI is going to replace us. So it's not just the pharmaceutical companies, it's our healthcare system. I'm kind of telling y'all from the inside what's the problem. And then the dumb nurses, I'm sorry, they thought it was going to change. Them chicks is striking today. Like, you still striking in New York after the COVID? I thought we all figured out that they don't give a damn. But anyway, let's just watch a little bit of this right here before we keep the broadcast moving. Um, I think I have a few more things to show you, and we're going to be getting off of this. Trump goes after nurses. Can I just complain a little bit? This will be my last complaint as a nurse. I swear to God, let her complain for me. Okay. Complain, girl, complain. While I go get my next information for you guys.
The latest thing, they've come after nurses.
Complain.
The people who do our day in and day out care, the people who do the hard stuff.
We ain't nothing.
People who do all the things that you don't want to do. Nurses.
They don't care.
They're critical to our healthcare structure. So what they've done is they are reclassifying nurses from professional to non-professional. Why is that a thing? It goes to how much student loan funding they can qualify for. A lot of nursing programs are 4-year degrees. Or maybe you go on and you get a master's of nursing or become a nurse practitioner, you get extra training, or you get specific training in labor and delivery.
All the time.
A huge shortage that we have in this country.
Baby.
And you're not going to have the funding to be able to do that. So what is that going to do? We're gonna have less nurses.
So how is this helping us? Like, I'm confused. That's what I'm saying. At the same time, you're trying to make this big, beautiful healthcare bill. You're attacking the frontline workers. We're more than frontline workers. Literally, I sometimes have to coach doctors into giving the right orders because I'm not about to lose my license. I was been a travel nurse for over 9 years, so they treat us a little different. So you have to prove your competency. They'll tell you anything. And I was night shift. Yeah. Some of them nurses, doctors I saved y'all from. I'm like, please, can I get this order? No, I don't say it like that. I kind of stroke their ego a little bit, make them seem like they're very smart. And then I make a note in the chart that looks like I'm kind of dry snitching on them and that I told them. And then they call me and give me the order. I'm like, fuck it. We got to do it. All right. So let's just close off with this, okay? Because we're going to follow up on this particular subject. This is what I wanted to bang y'all and hit y'all in the head with. One more time. ICE budget versus the American healthcare spending for 2026. Let's get it. Okay, so in 2026, we already kind of hit what ICE is supposed to be getting, but this is just a short base again to remind you. And this is just a part because we found more money coming from different places yesterday. Not only did the Democrats sign the bill, but they also got some money coming out of the big, beautiful bill. And they already have their budget that was already allocated to them or yearly. Okay. Yeah. So this is just partial of it. So this is ICE agent budget again, base supplement funding. It says while the base 2016 budget was initially around 11.1 billion, newly authorized legislation adding on in addition to the big beautiful bill provides 45,000. Yesterday it said 67,000 according to the BBC. But anyway, for detention and $29.85 billion for operation procedures. Oh, okay. That's probably why they said that. Okay. They wasn't off. And they're going to be, so that's just right here. That's just right here. We're going to compare that. We're going to compare that. Okay. Now, it says the capital total capacity, the combination of the funds is fully utilized for 2026. It says could bring ICE annual budget to about $28,000 to $29,000, aimed at support as mass deportation and detention campaigns continue. Now, this $28,000 to $29,000, I don't know what they say when it comes to total capacity. They may be talking about the actual facilities. So that's something we have to keep in mind, highlighting that budget we saw did not incorporate. Give me 1 second. Hold on a second, y'all. My mouth a little dry. Help me out. Shut up. All right. The budget we saw did not incorporate everything we're talking about. Let's just move on to the comparison. It says the ICE budget, while massive related, the approach is near $30 billion annually operation, more than what is proposed to go into the American health care bill. Okay, so I'm going to see if they ever put the actual budget out for this healthcare bill. What are they trying to do? And we're going to look at it and compare it. But just for primitive, because he just made this announcement 7 days ago, allegedly, it's saying that it's at least $30 billion less what we're getting in healthcare versus what ICE getting. Just the allocation, because I think this is just talking about the allocation. It's not adding everything else up. We added up yesterday, ICE is getting about $250 billion. Go look at that video, about $250 billion. So, do we need to address this or don't we? I do think we do need to pay attention to this. We're going to revisit this. I want to say thank you guys for being here. I thought this topic was pretty dry, but I'm glad that the American people and people around the world is waking up. The next issue, too, I just want to highlight that Trump approach to separating themselves from the World Health Organization. That's something that we have to watch. I'm not sure how that will work. As I say, I do think that we have the concept of being a good neighbor internationally, especially when it comes to disease and healthcare practices. I think American healthcare system needs to look at other countries' approach to healthcare, especially eating and banning certain foods. Like, come on, you letting Bill Gates rock out with his cookout, giving us all this food. That has no caloric substance to it. Oh, damn, I'm about to just start going down the yellow brick road. So that's what I'm saying. There's a lot of contradictions. Mega. We ain't going to give you no low vibration of shit. Think about this, Mega. There's a lot of contradictions to what he's saying he's proposing that makes this a big, beautiful healthcare bill. I'm still kind of skeptical about Robert. We're going to watch him. We're going to see what goes on. I said I'm a little biased because I liked his approach before. You see my post-traumatic stress came out, but we're going to see what he do, because I do agree with the vaccine schedule being cut in half. I don't think that children should get all of these vaccines, not only because I'm a Hebrew and I think God created us naturally and our body could kick ass like mine did, but also it's because they have a lot of chemicals in it, and now they're using nanotechnology, and they're not really letting people know what nanotechnology is. So again, we have more experimenting going on in the healthcare sector that is happening right now. So let's start paying attention to it, because they're also implementing new technologies in these particular prescriptions, and it is nanotechnology. Now, let's start right there. With that goes to say, thank you so much for being here. I know I didn't get in the comments. Y'all want me to get in the comments for a second? Let's get into this. It says, by 11 government funding the schools that have been overcharged and hopefully will drop their prices. Let me see what you were saying. It's Nemison. I'm saying your name wrong. Nemison. I hope I'm saying it right. USA. Let me check it out. Hold on 1 second. If you want to go to school, you need to pay for it. How do we pay for it when the school is inflated? It's just inflated. That's why I never went to law school after I got my bachelor degree program. I had 2 kids that I'm like, yo, they're going to have to go to college. College is off the fucking hook. They even set the kids up. Oh, don't let me start talking about that. My daughter first semester in college, she was mandated to stay on campus and rent from them and get a meal plan, all types of stuff when we could have came up with stuff. And then the meal plan wasn't enough. I still had to send money. Oh my God, you got me going down yellow brick road. How do we pay for it when our budget is not inflated? If I wasn't a travel nurse and God didn't bless me to have the tolerance to deal with that and not break down, I don't know how I'll be where I'm at with my kids. Okay. I don't know how y'all do it with just a regular income. It's not easy. That's why I push for people to be business owners on the side of working, regular 9 to 5, because they did minimum wage $15. The average cost of a home is at least $275,000 to $325,000. Our kids stuck. Let's go. It took 20 years to speak up. You was talking about Robert F. Kennedy, baby. He was up there on that cocoa having too much damn fun. Probably with Epstein. Shut up. I'm sorry, y'all. I don't put nothing past nobody. Y'all know I don't care. What you was doing. What the fuck you was doing? You ain't got no nose bridge. That's why you sound like that. Let me stop, y'all. Okay, I'm out of here. Y'all gonna get me in trouble. I love you guys. With that goes to say, I'm gonna see y'all tomorrow where we're gonna get a little bit more heavy. We're gonna be getting into Russia, China, and Nigeria relationship. Ooh, the African continent. But I really want to highlight China's economic status, what they have been doing with their oil, and what they have been doing with the blockchain. I've been talking about it, throwing stuff at. We about to show you. They creating a whole new sector and a whole new economy and a whole new way of trade that America is locked the hell out. That's why he's trying to be nice to China. Peep it. Y'all watch this? He said he wants China to be part of the negotiations board or overseeing board over what's going on with Venezuela. And I'm done. Y'all better pay attention, y'all. The rig is up. The jig is up. Hit the like button. And thank you for being here with Ms. Grace. You know how we go out. And you know who walks with us every day. Who is that? Hit the like button. Thank you, and turn your notifications on, please.